Hyperglycemia is a condition characterized by elevated levels of glucose sugar in the blood. It is a key feature of diabetes and can have various causes and implications. Here's a detailed overview. Causes: hyperglycemia can occur for several reasons, including diabetes mellitus, type 1 diabetes, an autoimmune condition where the pancreas produces little or no insulin; type 2 diabetes, a condition characterized by insulin resistance and eventually a decline in insulin production. Gestational diabetes occurs during pregnancy and typically resolves after childbirth, but increases the risk of developing type 2 diabetes later on. Inadequate insulin or medication. Not taking enough insulin or diabetes medications, or not adhering to the prescribed treatment regimen. Dietary factors. Consuming high amounts of carbohydrates and sugars can raise blood glucose levels. Physical inactivity. Lack of exercise can contribute to insulin resistance and high blood sugar levels. Stress. Physical or emotional stress can lead to increased blood sugar levels due to the release of stress hormones like cortisol. Illness or infection. Illnesses, infections, or other health conditions can increase blood sugar levels. Medications. Certain medications, such as corticosteroids, can elevate blood glucose levels. Hormonal imbalances. Conditions affecting hormone levels, such as Cushing's syndrome, can cause hyperglycemia. Symptoms. Hyperglycemia may not always present symptoms, especially in its early stages. However, when symptoms do appear, they can include increased thirst, persistent feeling of needing to drink more fluids, frequent urination, increased need to urinate, often accompanied by large volumes of urine, fatigue, feeling unusually tired or fatigued, blurred vision, difficulty seeing clearly, which can occur due to changes in fluid levels in the eyes, headaches, persistent or recurrent headaches, unexplained weight loss, losing weight without changes in diet or physical activity, dry mouth and skin, dryness in the mouth and skin, sometimes accompanied by itching, slow healing sores, cuts and sores taking longer than usual to heal. Diagnosis of hyperglycemia involves several tests. Blood glucose tests. Fasting blood glucose measures blood glucose levels after fasting for at least 8 hours. Random blood glucose measures blood glucose levels at any time of day, regardless of food intake. Oral glucose tolerance test (OGTT) measures blood glucose levels after fasting and then consuming a glucose-rich drink. HbA1c test provides an average of blood glucose levels over the past 2 to 3 months. Urine tests. Testing for glucose in the urine can indicate hyperglycemia, although it is not used for diagnosis on its own. Treatment and management. Managing hyperglycemia involves a combination of lifestyle changes, medication, and regular monitoring. Lifestyle changes. Diet. Adopting a balanced diet that is low in simple carbohydrates and high in fiber, lean proteins, and healthy fats. Exercise. Engaging in regular physical activity to improve insulin sensitivity and help regulate blood sugar levels. Weight management. Maintaining the healthy weight through diet and exercise. Medication. Insulin therapy. For people with type 1 diabetes or advanced type 2 diabetes who require additional insulin. Oral medications. Various medications that help lower blood glucose levels, such as metformin, sulfonylureas, and SGLT2 inhibitors. Other injectable medications, such as GLP-1 receptor agonists, which help regulate blood sugar levels and sometimes promote weight loss. Monitoring. Regular blood glucose monitoring to track levels and adjust treatment as needed. Continuous glucose monitors (CGMs) can provide real-time glucose readings. Education and support. Diabetes education to understand how to manage the condition effectively. Support from healthcare professionals, including dietitians, diabetes educators, and endocrinologists. Managing underlying conditions. Addressing any contributing factors or coexisting conditions that may impact blood glucose levels. Complications. Chronic hyperglycemia can lead to serious complications, including cardiovascular disease, increased risk of heart disease, stroke, and high blood pressure. Neuropathy. Nerve damage leading to pain, tingling, or numbness, particularly in the extremities. Retinopathy. Damage to the blood vessels in the retina, which can lead to vision problems or blindness. Nephropathy. Kidney damage that can lead to kidney failure or require dialysis. Foot problems. Poor circulation and nerve damage leading to infections, ulcers, or amputation. Conclusion. Hyperglycemia is a manageable condition with appropriate lifestyle changes, medication, and regular monitoring. Effective management is crucial to prevent complications and maintain overall health. If you have concerns about hyperglycemia or diabetes, consult with a healthcare provider for personalized advice and treatment options.